11 Alive is where Atlanta speaks, and we really want to hear from you on this issue. Tomorrow is the big day. Georgia is planning to reopen some businesses with strict restrictions in a lot of cases. We wanted to hear from the community about what they thought about this. So we wanted to bring people together to have a discussion about reopening in Georgia and what that's going to look like. We're joined with 4 different people who have 4 very different opinions about this, and we want to bring in all sorts of different voices to this conversation. So I'm joined with Sherry, Tim, Tom, and Adrian. All of them responded to our call to join in on this conversation. And so, Tom, I wanted to start with you because you do have a background in the medical field. Talk to me about how you feel about Georgia reopening at this point.
I know it's all confusing for everybody because you hear so many different things on the news. And I'm in the fortunate position to have, when Fauci talks and when the CDC head talks, I really understand what they're saying. I agree with President Trump, which is rare, on his recommendation to the governor to not do this. I think it's way too early. The numbers are going up. I'm 67 years old. I'm in the high-risk group. I want to share what I experienced just a couple days ago. I had to go out and get medications. And unfortunately, I had to go to 2 different pharmacies. The one I walked into, I won't mention locations or anything like that because I don't want to point fingers, was full of a lot of young people. And not a single one was wearing a mask, which we've been requested to do by the federal government. I went into our Publix store in our neighborhood, which is mostly elderly, and almost everyone had a mask on. And I am so afraid that when things are reopened, I see cavalier behavior when things are closed, that we're just going to have a massive second outbreak of corona in the Atlanta area.
Well, Tom, you bring up a good point about fear and adhering to the regulations, because I think that is something that's going to be difficult for a lot of businesses. Tim, you're reopening your salon tomorrow, and I know you have a long list of regulations you have to file. Can you talk to me about what that process is going to look like for you?
Right. Well, as most everybody, I was surprised when Governor Kemp said that we could reopen on Friday. I actually anticipated that he was going to extend the amount of time that we should be closed. So when he opened, I immediately got with my staff. We've been staying in close contact and weighed the pros and the cons and what we could do if we did decide to open, what we should do to protect not only our staff, but all of our clients and therefore the general public. I think that the businesses that are given the option to open need to do so responsibly. They bear the burden of being sure that anyone that enters their establishment does it under certain guidelines. What we will be doing is the doors to our business will remain open, so nobody touches the doors. As the clients enter, they will have their temperature taken. They will have a series of questions that they need to answer and with a signature certify their answers. At that point, everyone receives gloves and a face mask. Our staff will also have their temperatures taken. We will not only have our gloves and our face mask, but we will also have face shields. We'll be wearing gowns to cover our clothing. And it's a 1 client to 1 service provider ratio. Nobody else is allowed to enter the building. We've spaced our stations. In some cases, they're 14 feet apart. No less than 8 to 9 feet apart, but mostly they're about 14 feet apart. At the point of checkout, we know cross-contamination as we've devised a way for people to check out without passing credit cards back and forth. So really, you as the building, or I'm sorry, business owner, bear the responsibility of being sure that if you're given this option to open, that you do it responsibly. And unfortunately, I do think that there will be, people out there that don't.
Well, I think it's clear how much thought you've put into this, how much effort you've put into it. But, you know, even hearing all of that, Sherry, would you be willing to go to a hair salon or a nail salon tomorrow?
Absolutely not. You can look at my hair. I need it. I can understand.
Your hair looks great.
I can understand wanting to do it. I cannot understand how you could get a manicure or a pedicure and be 6 feet apart. I don't understand how I can wear a mask and get my hair cut. And I understand that, especially some of the salons, and I'm not slinging mud here, please, but that if you have nail stylists that are not making a lot of money, and suddenly they're told, well, you come in and your job is gone. I think this is putting an unfair burden on the lower paid employees and the kind of stress that they really don't need. It's bad enough if it's closed and you're not getting paid. At least you know when you go back and when it's safe, your job is there. Now, you either go in and risk your life or you don't have a job. So no, I'm not for this at all.
Greg,
If I could just elaborate on what you had said, in our circumstance, I'm not speaking for every business, but in our circumstance, the decision was really left up to my staff. This was information that they've been asking me the whole time. They're not getting a lot of the stimulus benefit that a lot of the people are getting. They weren't receiving the unemployment. Things were very unorganized. And we have real people with real life situations where they don't have money and they have real bills to pay and families to feed. No one has to come back to work. This was their decision. This is what we all decided to do together. So again, no one at my establishment has to come back to work. I support everyone that feels comfortable with being at home with their families. Quite frankly, I would feel more comfortable being home with my family. But I'm going to do what I can to get my staff who wants to get back to work, And when is the right time? Is it next week? Is it the 1st of June?
Well,
the coronavirus is here.
The CDC pretty much said when the right time is, and so did President Trump. Even if you follow those guidelines, we are nowhere near being ready to get back to work. Our cases are still going up, not leveling, not going down. They're going up. So I'm sorry. But
well, let me bring in Adrian here
to attack you in any way.
Oh no, absolutely. I think this is a great conversation. And Adrian, you weighed in on Facebook and said you are really more middle of the road on this. You said you understand that people have an economic need, but you also understand that people are scared of this virus.
Yes. Me and my husband are small business owners. We own an independent insurance agency. And so for us, we understand there's a true fear for the virus. The virus is still out there. Our numbers are increasing. They haven't leveled off and they're not declining right now. But I do understand the economic issues as well for small business owners. That's how we pay our bills. We pay our bills as small business owners and we employ people in the community. However, for me, I'm in the middle of the road because I don't see how opening up right now is going to be that much more beneficial to the economy. Because there's a lot of businesses, most of the businesses that I'm in contact with that I follow on Facebook, they're not willing to open. They're not willing to risk the reputation of their business. They're not willing to risk the health of their employees or their customers. And then there's customers that patronize these businesses that are just simply not willing to go out. So for me, I don't know how much of an economic advantage opening right now will be giving the economy. I just don't see that. But again, I do understand that people are unemployed, they need money, they need food. So for me, I'm in the middle of the road. I have 3 children. One of them has asthma. So I don't want to go out and put him at risk. But again, I think there's some real concerns and I think it's just too early right now. I agree. The CDC has outlined when it would be safe to open up. We haven't reached that point yet. And I think if once we get to that point, we can have a real tangible conversation about opening up. But I think right now is not the time.
And Tom, what do you think about that?
Can I say something here?
Yeah.
First of all, my wife and I had a lengthy conversation this morning about how we would have felt if this would have happened when I was 35 years old and had 3 children and bills coming in from every direction. And would we have reacted differently then than now, where we're retired and we still have an income? And I totally respect every person who is dealing with the financial burden of this. And that's not why I'm against it. I mean, we are rapidly approaching in this country the number of deaths as the total number of casualties in the Vietnam War. And when you think about that, and when you think about we have as a people the opportunity to do something about it, I think it's so important. The opportunity to do something about it, I think it's so important. And I wanted to ask Greg, but where'd he go?
I know we lost Tim. I'm not sure what happened to his connection, but hopefully we can bring him back in.
Because I had a couple questions for him about how he obtained PPE. He sounds like he has a great plan. All we hear on is there's a tremendous shortage of PPE for the healthcare workers. How did he get it? And does he have any reservation about using PPE to cut hair when it should be being used to protect the people that are saving our lives? So,
right, I think
that is a great point. I hate to cut in, but I think that is a great point, because again, someone just mentioned being out at the grocery store, the pharmacy, and there was no one wearing masks. People aren't wearing masks because they can't find them anywhere. So I would be curious to know too. Yes, how is he finding that PPE? But yes, I agree too. If we can save lives, if we can save a life by just staying home a little bit longer, that's worth it. I think for humanity, that should be worth it for everyone.
And Tim, we lost your connection briefly, but I wanted to bring you back in here because I know you had a lot of regulations you were following. You were making sure you were being very safe as you were reopening. Do you expect that your customers are going to come in? Because I think Sherry said she didn't know whether or not people were going to come in. Do you think you'll have a full case of customers?
Well, that was the reason that we decided to open also, because we had a very long list of people that wanted to come in, and the phones started ringing off the hook as soon as he made the announcement. So we're actually fully booked for 7 days, and we're taking appointments. Yeah.
So it seems like the demand is definitely out there to you.
For us, it is. Yes. Our community has responded, and that was one of our determining factors.
Well, Tim, our connection's not great. I'm sorry, we're kind of losing you. Well, let me bring it back around as hopefully we reestablish Tim's connection. Sherry, what would it take for you to feel comfortable to reopen and have everything going back full?
I think it's going to take a really long time before it's full swing. I mean, even when things open back up, I think we're still going to be maintaining some distances that we didn't used to do. I think that the broad guidelines that we received from the CDC and from President Trump are a very good start. And I think we ought to ease into it and do it as rapidly as possible, but safely if at all.
How about you, Adrienne? What will make you feel comfortable?
Testing, increased testing. And a decrease in the number of cases that are being reported would make me feel much more comfortable. Again, with having a son, I know he has asthma. I could be asymptomatic and go out and pass it on to him, and that's a real fear for me, because I feel that there's a lot of asymptomatic people, and again, costing someone their life for that reason. It's just not worth it to me.
How about you, Tom?
I lost my train of thought. I apologize.
No problem. We're just talking about what would make you feel comfortable to open back up.
I think we really, and I hear it over and over from the science people. I don't think anyone has a good understanding of this bug, how contagious it really is. We were told 6 feet social distancing. Now you see these reports coming out of, I forget where it was, Harvard or some laboratory, where they show a person coughed and it went as far as 14 feet or something like that, and that the droplets can hang in the air for hours. This may be part of the explanation as to why this virus is 4 to 6 times more contagious than the flu. I think we have way too much to learn. And with the case counts going up, I don't think we're in a position where it's safe. And I think it's too early. And I think we can test all we want, but we need more knowledge about how this organism actually spreads. I'm very confused by these asymptomatic people who can pass it on. I don't see how you can have a high enough viral load in your body and be asymptomatic and be contagious. It's very confusing to me. And I think it's probably very confusing to the epidemiologist as well, except they're not talking about it on the media.
How about you, Tim?
You know, I have concerns, I have to say. You know, I definitely have concerns. But again, I've taken a lot of factors in consideration, and we're doing everything. We're doing as much as any medical office is doing to see our clients. You know, and that's really all we can do. I'm going with the fact that my staff, I speak for me, I won't speak for other business owners, my staff needs to get back to work. They have no income. They have no way of living right now. I haven't received any type of stimulus or support to help them. And I have a community of people that are wanting to come in. So I have to stand back and look at every possible precaution that I can make to try to make the decision to do it responsibly.
Right. This is a hard call for people. I think there's a lot of fear. There's a lot of different opinions about this. There's a lot of passion on all sides. So I just
may I ask Greg my question that I asked when he was disconnected? Mm-hmm. First of all, Greg, I want to tell you I totally respect the financial burden that you and your employees are under, and I feel for you. But it sounds like you have a very good plan to try to run your business as safely as possible. But what immediately popped into my head as you were sharing your plan was, all we hear every day on the media, there is not enough PPE for the healthcare workers, for the frontline healthcare workers. How did you obtain the PPE, implement your plan? And secondly, do you feel you're taking this material away from our healthcare workers that need it the most?
No, actually, I think you misunderstood. I have not received any of that.
Well, then how are you opening?
With money that I do business in a smart way, so I have reserve.
When Tom says PPE, he means the personal protective equipment, not the PPP, the loan. So he's talking.
I'm sorry, I thought you said PPP. I am so sorry.
No.
I'm so sorry.
No, the connection's kind of bad.
Oh, okay. I'm sorry. So because of the type of business that we are, we constantly wear gloves because of chemicals and things, and we also wear face masks because we do hair treatments and things that sometimes just require that, or people don't like the fumes. So luckily in my business, these are things that I stock up on anyway all year long.
Okay.
And now the face shields, that's a different story. The face shields I'm able to order online, and it seems like there were plenty of those available.
Interesting.
Oh, so that's a good point.
What we hear on the media appears to be slightly exaggerated about the lack of PPE for the healthcare workers. If you can readily get face shields, I can't figure out why our healthcare workers can't. So that
Right. I ordered them. I got them in 4 days. And the same thing there are with gloves. I saw that I could still buy, luckily I have a lot of gloves, but I could still buy gloves and face masks. I had to search a couple places, but I found them available. I had people that were asking.
very interesting.
Yeah, that's good. Anyone have closing thoughts here? Sher or Adrian?
I don't think so. I will say that I did go online and checked, and I couldn't find a mayor in Georgia that agreed with this decision.
What do you think, Adrian?
Final thought, I just think everyone needs to, if you can stay home again, stay home. And if you can't, I completely understand, but I think everyone should try to be as safe as possible and just heed the advice of the scientists and the medical professionals and just stay home.
I want to thank you all so much for being willing to weigh in on this. I know it's a topic people feel really passionately about. There's a lot of fear, there's a lot of misunderstanding. So I appreciate all of you taking the time to talk to us. And we want to get you in on the conversation as well. 11 Alive is where Atlanta speaks. So if you have something you want to get in on this, please leave it in the comments. We're going to do our best to bring as many voices into this conversation as we can. So thank you so much for joining us, and everybody stay safe.